It has been so long since I posted my first video that I literally had to go back on YouTube and watch the end of the video to figure out where I left off. Which is actually super ironic considering the fact that I filmed this 4 months ago and I'm just editing it now. Whoops. Because so much has happened since then and I didn't know where I needed to start. We last left off at the end of my surgery. I told you I got the biopsy results back, that it was cancer, and that I would need to do a second surgery so that I could do the radioactive iodine treatment. So the first thing that happened after my surgery was I needed to go to a follow-up appointment to get, if you remember, I had those bandages on the scar. And so I had to go back to the surgeon so that she could remove the bandages and make sure that the scar was healing correctly. And it was. It actually looked really, really good. I was super impressed and super happy because I had been so nervous about having a big, ugly scar on my neck. So after she got the bandages off, we talked about some stuff. We talked about the second surgery, when I would need to be doing that, and what it would look like. We talked a little bit about the treatment that I would be going through after the second surgery. She set me up with one of her doctor friends who specializes in thyroid cancer, who would be my doctor after the surgery to help me go through everything. And because the biopsy from the first surgery had shown that I had cancer in the blood vessels surrounding my thyroid and also in a couple of the lymph nodes around it. She had decided that she wanted me to get an ultrasound of my entire neck to look for any remaining cancer in there, especially in the lymph nodes. And she wanted me to get a chest x-ray. And the purpose of this x-ray is to see if there was any cancer visible within my lungs. And the reason they wanted to check the lungs is because the cancer from my first surgery had originally spread to the blood vessels, which means that there was a high probability that it could have spread somewhere else in my body. And the first place that thyroid cancer spreads is generally the lungs. So she wanted to check out my lungs to make sure that everything in my lungs seemed clear. So when I got the results, they told me that my lungs seemed clear, but they were a little concerned about my ultrasound. There's 2 lymph nodes that they wanted to check out. One was up here on the left side and the other one was over here on the right side. They said that they didn't really see anything definitively suspicious, but also they might not look completely normal. And so they were like, we're not really worried about them, but we want you to get them biopsied just in case. No, we weren't really worried about them. My entire life is doctors telling me, we're not really worried about it. And then everything goes wrong. So I got scheduled for the biopsy and I went in and it was just like the one that I did before. I can't remember if I explained it to you in the other video, so I'm just gonna explain it super quick. So it's ultrasound guided, which means that they just do an ultrasound on your neck to find the specific part that they want to biopsy. So they just ultrasounded over this little patch until they found the lymph node that they wanted to biopsy, and then they take a numbing spray and they spray it right on your skin, and it's super duper cold and it kind of burns, but it numbs you so that they can put a needle through your skin into the lymph node. So they put the needle in and then they go in and out maybe like 5 to 10 times because they're just trying to gather up as many cells from the lymph node as they can. And they do that 3 or 4 times to each lymph node that they're testing. So they did that once on the left side and once on the right side. So I got 7 needles to the neck that day and I went home and I was fine. And a couple days later they called me and they said, we just got the results from your biopsy. We're really pleased to tell you that both of the lymph nodes that we tested look completely cancer-free, and this is a really great sign for you. So with all this apparent good news, we were home free for the surgery. So I had my surgery scheduled and everything was great. Got my time off work. I went in for the surgery. I had the surgery done without any apparent major complications. However, I do have a story for you, which I can put in another video. I had a really bad reaction to whatever they gave me to put me to sleep, and no one seemed to think that it was a big deal, but I kid you not, legitimately thought that I was in the process of dying. But I will make another short video with that story because I really like that story a lot. The time I almost died. So, got the surgery done. I stayed in the hospital overnight. I was healing up super duper quickly. I was feeling a lot better than I did after my first surgery. I was really energetic. I was up and moving, walking around. So I was like super excited. I was like, the journey's about to be over. But I was wrong. So I had the surgery on a Friday, and the Monday after the surgery, I had my first appointment with my new cancer doctor. So my mom and my dad were there, and we got up super duper early to drive into Philly. And we got there, we were the first appointment of the day, so we waited a little bit, and then we went in, and my doctor's fellow took us in. She like introduced herself, she talked to us a little bit, told us what was going to be going on, and then she went to get the doctor. Now, if you've ever been to the doctor in your life, when the first person that talks to you goes to get the doctor, it can take a long time. Like 10 to 20 minutes. We were in this room waiting for the doctor, I kid you not, an hour. And we were starting to get like a little weirded out, suspicious, like, why the heck is this taking so long? She literally said the doctor was ready for me, she's going to get the doctor. So an hour later, the doctor finally comes, and she looked frazzled, to say the least. And she talked really fast, which made the situation so much more frantic. But she comes in and she's like, hey, I don't know how this happened, but we've got some bad news for you. So she proceeds to explain to me that somehow, in the process of getting the biopsy results back from the lymph nodes in my neck, my results got mixed up, and somehow my doctor saw the results for the right side twice and thought they were two different results, one for the left side and one for the right side. Now, since the right side had no cancer in it, she saw two right side reports and thought, right side has no cancer, left side has no cancer. So they called me and they told me that I didn't have any cancer in the lymph nodes that they biopsied. Well, it turns out that the morning of my appointment, my new cancer doctor had gone through every single file, chart, test result in my file to kind of get ready for my appointment. And she found the biopsy for the left lymph node, which my surgeon had apparently never seen. And it turns out that the lymph node on my left side did in fact have cancer in it. Great. So basically she was like, yeah, so you still have cancer in your neck. And at this point, my mom starts crying, and I'm like super positive about this, but like seeing my mom cry is now making me cry, and now all the doctors in the room feel like super uncomfortable because they kind of made a huge mistake telling me I didn't have cancer when I did. I'm like trying to cover up the fact that I'm crying because I'm like, don't want her to think I'm upset about what she's telling me. I'm just crying because my mom's crying, and when my mom cries, I cry. It was like this big thing, and my mom is like clearly very upset, and the doctor is like trying to comfort my mom. It was like it was an extremely awkward experience, and she's like apologizing profusely and repetitively trying to explain to us like how this could have happened. How did it happen? Who knows? But like, that's a huge mistake to make, to tell somebody that they don't have cancer when they do. Come on, people, you're supposed to be like one of the best medical facilities in America, whatever. She basically told me that if they had known this, the surgeon would have gone into my neck up here while I was in surgery and taken that lymph node out, but obviously because they didn't know, the lymph node was still in me. She then proceeds to like draw pictures for me about how this lymph node looks and why she's not super concerned about the cancer in this lymph node. Basically what happens with thyroid cancer is that the cancer spreads through the tissue. So if you have thyroid cancer anywhere else in your body, you have thyroid tissue somewhere else in your body. So basically what she was saying was that the lymph node that had the cancer in it looked so slightly abnormal that most doctors wouldn't even have recommended that I get a biopsy because it didn't look cancerous at all. So she was explaining to me that this really wasn't anything to be worried about, that the lymph node was like, it looked so normal that the cancer in it must have been so small. So after the shock of finding out that I still do have cancer in my neck for sure, the nurse that's going to be helping me through the radioactive iodine treatment comes in and she explains everything to me. Now, I'm going to do an entire separate video on the radioactive iodine treatment, so I'm going to skip over this part of the story. But a small part that you should know is that they did tell me that they were kind of hopeful that through the radioactive iodine treatment, they might be able to kill out the remaining part of cancer that was in this lymph node and that we wouldn't have to worry about it any further. My mom had also expressed that she was like very worried about whether or not the cancer had spread anywhere else in my body. And because they did see a lot of cancer in the lymph nodes and they had seen some in the blood vessels, they decided that a more accurate test for my lungs would be to have me do a chest CT, because a chest CT can see things that are a lot smaller than what an x-ray can see. So she also talked to me about a protein called thyroglobulin that helps synthesize thyroid hormones. And so basically they use thyroglobulin as a test to see how much thyroid tissue is in your body. So if you had an entire thyroid, you'd have a lot of thyroglobulin, but if you have your whole thyroid removed, you should have very little thyroglobulin in your system, if any, because you don't have any tissue to produce it. So basically how this works is if you're missing your thyroid but you have a lot of thyroglobulin in you, that means that there is thyroid tissue somewhere else in your body. And if thyroid tissue is anywhere else in your body besides right here where your thyroid is, that means that you have cancer somewhere in your body. So they use this as one of the main ways to see if you have cancer anywhere else in your body. However, they did tell me that some people, and I want to say, if I'm remembering correctly, it's like 20% of Americans have this antibody called, I think it's just called anti-thyroglobulin. And it basically prevents them from getting an accurate reading of the thyroglobulin. For most people who have this antibody, it's really not that big of a deal because they're not getting their thyroglobulin tested. The only way that it would be a big deal is if you are getting your thyroglobulin tested, because it can mess with the readings and it basically prevents you from getting an accurate reading. So after this doctor's appointment, I went to get all of my blood tests. I had to get my TSH, which is thyroid stimulating hormone, tested, which basically tells me how much of the thyroid hormone I have in my body, which at this point I was on artificial hormones, and I will be for the rest of my life because I don't have a thyroid to produce the hormone. So they had to see how much of the hormone I had in my body to see if maybe they needed to up the dosage of my pills or bring down the dosage. I had to get my calcium checked because they're like little thingies around your thyroid that help produce calcium for your body, and they can get damaged in the surgery. And then I got my thyroglobulin checked. I think those are the only 3 things I got checked. But anyways, right after my appointment, I went down to the lab and got blood work done. But I got a call later that day that the results from my thyroglobulin test had come back, and I did indeed have the ever elusive antibody, which is just a pain in the butt, to be honest. I mean, it means that my thyroglobulin levels cannot be trusted. Can't trust them thyroglobulin levels anymore. So it's just more of an annoyance than anything. They do say that over time the antibody can go away. Who knows? It is what it is. My TSH was a little too high, meaning I didn't have enough hormone, so they gave me a higher dosage of my medication, and my calcium was way too low, so I had to take Tums. Yeah, so that was that. I got a higher dosage of my medicine. I have to take Tums until I die. Actually, I genuinely don't know how long I have to take Tums. I don't know if it's gonna be like a lifelong thing or if eventually my calcium will go up. The next step was the CT in my lungs. I got it done. It was super quick. Just got in the little CT tube for like 3 minutes. I was at work when I got the results of the lung CT, and I'm pretty sure that the girl that shares a room with me thinks I'm insane, because anytime I get a call from the doctor, I like run to the whiteboard and just start writing down everything that they say, because don't want to forget it. I gotta relay all this stuff to my mom, and she gets she's not very pleased when I forget everything that the doctor said, which has happened. I'm a little forgetful. It's apparently a side effect of my cancer, but I'm not gonna blame it on that. I'm just a really forgetful person. They call me, I'm at work, I'm writing all this down on the whiteboard, and they say, so we got the results of the CT back and we see nodules on your lungs. Mind you, this is Dr. 1 out of 3 people who will tell me the results of the CT, and 1 out of 3 different interpretations of these results that I will get. The first doctor was the fellow of my cancer doctor, and she tells me, hey, we got the results of your CT and you appear to have some nodules in your lungs, and they're too small to biopsy, but we're working under the assumption that since you have all of the other stuff that you have, that the cancer has metastasized to your lungs. Metastasized just means it moved from my neck to my lungs, and we're working under the assumption that we're pretty positive that you have cancer in your lungs. Now, for those of you who know nothing about cancer, when thyroid cancer metastasized to your lungs, it doesn't mean you have lung cancer, because lung cancer is a totally different thing. It just means that you have thyroid cancer in your lungs, which is a much more treatable thing than lung cancer. So she tells me we're pretty positive that the cancer has metastasized to your lungs. She says, your doctor is in Europe, she won't be back for 2 days. She can call you and give you all the information after that. So basically, she calls me and tells me, hey, you have cancer in your lungs, and I can't give you any more information than that. You have to wait 2 days. So I'm like very freaked out at this point. This is honestly the first time I ever remember being worried and scared. So I called my mom and told her, and she's like, what does this mean? And I was like, I don't know. And she's like, are you okay? And I was like, yeah, Mom, I'm totally fine. And I was in that moment, but then I went to tell my vice principal because I didn't know what that was going to mean for my time at work. And I broke down. I walked out of her office and I was just crying. I started to get really scared, and I just not getting that news and then not being able to talk to a doctor about it for 2 days is insane. I was looking up stuff on the internet, and you can't get a straight answer from the internet. I didn't know what was going on. I didn't know how serious it was, and then I'm starting to think, am I gonna die? And so I remember I texted my mom, and I was just like, Mom, am I gonna die? And she was like, Alicia, no, absolutely not. You're not gonna die. And so I went through maybe a 2 or 3 hour phase where I was just I was destroyed. I didn't know what was going on. I didn't know what to expect. I didn't know what to believe. And luckily that phase passed really quickly. And luckily, that's the only time in this whole 7-month journey that I've felt scared or worried in any way. The doctor did eventually call me. She gave me a slightly different story than the first doctor told me. She said that there's really no way to know what they are. We're not necessarily working under the assumption that they are cancer, but they very well could be, and they very well could not be. But that she told me that they were too small to biopsy, so we would just watch them. So she told me that since they saw this in my lungs and they didn't know what it was, they wanted me to actually meet with nuclear medicine, which is who would be actually administering the radioactive iodine to me. They wanted me to meet with them, talk with them, discuss everything with them, and that they would probably end up giving me a higher dose of the radioactive iodine. That way, if what was in my lungs was indeed cancer, that hopefully the radioactive iodine would go into my lungs and it would get rid of it all. So yeah, that I guess that's the end of this part of the story, because everything after this point is about the radioactive iodine, which I am going to put in a separate video, or else this video will be like an hour long, and you don't want that. So there will be at least 2 other videos. One, like I said, will be the radioactive iodine video, and the second will be a really quick short video about my weird reaction to the anesthesia that they gave me. Yeah. I'll post the links on Facebook and Instagram and Twitter and whatever, just so that you can stay updated. If you want, you can subscribe to my YouTube channel. That way you can see my stuff when I post it. But I honestly don't care. It's more for you than me. So yeah, I hope you have a great day.